So let's talk about liposuction. Liposuction has been around for over 30 years and has become more and more popular every year. Now, what is liposuction used for? Generally, it's used to remove excess fatty deposits. In women, they typically come in complaining of excess fat in their belly, in their flanks, in their inner thighs or outer thighs, sometimes even in the inner knees. For men, men typically complain of their abdomen, their flanks, and sometimes their chest. Both men and women may also complain about fat in their chin area or submental area. Techniques and technology have improved dramatically since the procedure was first invented. Now, most liposuction procedures are done with what is called the tumescent technique. All this means is that prior to removing the fat, the area is first injected with a solution that usually contains anesthetic medication and epinephrine, which minimizes bleeding. Now, there are different ways to remove the fat. However, the most important thing is not the technique used, but the judgment and experience of the surgeon doing the procedure. There are also various terms out there like liposuction, liposculpture, microliposuction. These terms are basically used interchangeably and just sound more extravagant or advanced when really we're all talking about the same thing, just removing the excess fat. Now, the classic liposuction procedure that has been around for more than 20 years is called suction-assisted liposuction. This involves use of a cannula attached to a vacuum. This is such a cannula. This part is attached to the vacuum, and here's the cannula that goes underneath the skin, and the fat is basically broken up here at the end. The fat cells are broken up and suctioned into the container. This is still a very effective procedure and is commonly done. This procedure has improved since it originated by use of the tumescent technique as well as the development of smaller cannulas. These cannulas come in all different sizes. Now, power-assisted liposuction is another term you may hear. It's basically the same thing except that the cannula is attached to a machine that makes the cannula vibrate. This makes it easier for the surgeon to remove the fat. The effect on the fat is really the same and the results are basically the same. Now, ultrasound-assisted liposuction, which has been around for over 10 years, uses ultrasound energy at the tip of the cannula to actually melt the fat. The cannula looks a lot like this one, except at the tip, there's ultrasound energy, and when it touches the fat cell actually melts and bursts. This is different from what suction-assisted liposuction does. Ultrasound liposuction is more effective in many cases, especially in male chests and the back, where it's more fibrous. In my experience, more fat can be removed more quickly with ultrasound. There are some additional risks with using ultrasound liposuction, such as the possibility of burns, so it is important that the surgeon have experience with this technology. Now, laser lipolysis is the newest technology available. Check the next video to learn about this procedure.